You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, dental implants. Who's a candidate? According to my first guest, he says no more dentures. He is North County's implant dentist, Dr. Henninger. Dr. Henninger, welcome to the program.
Thank you, Randy.
Now, thanks for coming on the show. We didn't beg you, but we've been trying to get you on the show legitimately for about a year and a half. Is that right?
It has been almost a year.
What was your hesitation? I'll put you on the spot here.
Randy, you're in the office so much. Just seeing
I do come in there.
Yeah.
I do come in there. So, okay, good. Now, before we get into today's topic, for people that don't know you, I mean, who's your typical patient? What are the procedures you do? I know you work with Dr. Henninger, which has been on the show. But what all do you do? Because you do more than just dental implants.
Randy, we see all types of patients. We're a family practice. We do cleanings. We treat people that have gum disease. We have a laser in our office to do that. We do Invisalign. Okay. We also are a metal-free office. We do CERAC crowns in a day.
Do people come in now to actually have them taken out? I mean, is that popular?
It is very popular, especially here in North County. Okay. There's a lot of people with aging dentistry that have a lot of silver in their mouth, and it just needs to be replaced.
And cosmetic? You do a lot of cosmetic?
We do a lot of cosmetic dentistry. And of course, a big part of our practice is dental implants. There's a lot of people up here in North County that have dentures that don't fit well, okay? Or a lot of people that are faced with losing, a tooth or a number of teeth.
Okay. Now, we've talked off camera. We said, I asked you in my green room, how many people do you think are wearing an upper-lower denture in San Diego? Because I don't think of people having dentures all over the place, but you say it's common.
It is very common.
How many? What's an estimate?
Probably 30,000 people.
30,000 people.
Are a dentalist are wearing dentures.
Like upper or lower denture?
Yep.
And you say what to that?
I say there's no reason why you should be walking around with loose-fitting dentures. We have dental implants. We have laser dentistry that is virtually painless. There's no reason for it, Randy.
When we say things like no more dentures,
right?
Is that an overstatement or an exaggeration? I mean, is that the future of dentistry?
No, that's...
Because you think that's true.
That's now, Randy. You can have, if you're missing all of your teeth, you can have your teeth back, okay? We can get you 95% of your function back.
What does that mean, function?
That means you're smiling, you're chewing. If you're wearing a set of dentures, you're probably functioning at about 20% of what the average person has when they have their natural teeth. With a fixed set of teeth, we can get you 95%, 100% back to normal.
What are the oldest patients you have getting dental implants?
We have patients in their 90s and even 100.
90 years old?
Exactly.
100?
Right.
Why do they want to do that, though,
Randy,
at 100?
Eating is a very important thing for us. Not only is it where we get our nutrition from, but we get a large source of entertainment and satisfaction from eating. And people may know that they only have 5 years left. They want those 5 years to be the best 5 years that they've had in their life. My grandfather, he's this big Italian guy. He's been wearing partials and dentures ever since I was a kid. And I knew it. This guy enjoys eating more than he enjoys breathing.
Okay. All right.
And I'm like, Grandpa, why don't we get your teeth fixed so that you can enjoy what you enjoy most better? He's like, oh, I'm too old. I want to go through the procedure. I'm like, we can help you. And he's a family member.
So you were trying to talk him into dental implants?
Absolutely.
For how long? Did you finally do it, by the way?
Long time. No, I still have not convinced my grandfather to do it.
How long is he? So he's got a loose-fitting denture. And what are his fears? I guess his fears are everybody's fears. What?
I honestly think he thinks there's nothing that can be done for him. And it's my job before too long. I'm going to get that guy a set of teeth so he can enjoy eating again.
Yeah. If you don't mind, I sent my father went to your office and he has dental implants. My father's 78 years old. This was a year ago, so he was 77 years old, right? He says, my dentures are fine. They're great. And I'm thinking, he's got to be like everybody else. He goes, no, they're fine. I literally forced him to watch one of my shows.
Right.
And he goes, well, yeah, I'll talk to them. So he goes there, he meets with you guys, Dr. Henninger, and he's a trumpet player.
That's right.
And he had a loose-fitting denture. So turns out he gets 2 implants, snaps in, snaps out. He calls me the next day and says, there's one thing, he's kind of a sarcastic guy, but he says, there's one thing he didn't do a good job. He didn't do a good job telling me that it wasn't going to hurt. Right? He said it didn't hurt at all. It was nothing. And my dad didn't want, and he told me, he goes, I didn't want to tell you, but the night before, I hardly slept. I was so afraid. And he said it was nothing. It was just in and out. And now, of course, it's like he said, I should have done it years ago. And it's very important that a lot of people wait a long time. They're miserable for a long time. Right. And I think that's, and I was thinking about this, and I think we've had this discussion that, my father's like a lot of people.
Yes.
That here at 78, he's been in dentures literally since he was 38, okay? And that's young. who knows what would have happened, how his life would have been different had he been, had a fixed set of teeth years ago.
Right.
So that is common. So you hear those kind of things all the time.
All the time. My friend Mary, she's really good friends with my grandfather, and that's actually how I met her. She had a catastrophic event where she broke something, and she had to go, fix it. She couldn't walk around the way she was. And she's like, my mother had dentures since she was 30 years old, and I've made it, and I'm 80 years old, and I still don't have dentures, and I don't want them now. And she's like, what can you do for me? We did 4 implants for her, and we gave her a denture that snaps into place, and she's like, I was never missing my teeth. This is as good as what I was dealing with before I had to have the rest of my teeth pulled.
Okay.
And to sit there and watch her struggle getting those teeth out of her mouth it just makes me smile so much.
Because they're so tight.
They're so tight.
Sometimes you have to loosen them to pull them out.
Right.
Interesting.
She was in just yesterday for a cleaning, and I sat there in the hygienist's chair and purposely did not help her get her teeth out, because I enjoyed watching her struggle with getting those teeth out of her mouth.
So no more dentures. Is this is this the happiest group of patients? Because I know you do all things in dentistry. You do a lot of dentistry.
We do.
But are these the people that are most appreciative as far as like maybe giving you cards or a hug?
They are. They're the most appreciative because they experience the most dramatic change. Okay, they go from wearing these loose-fitting dentures to, an implant-supported denture or a fixed set of teeth, and they often say, "Why did I wait so long, Randy?" I mean,
okay.
I get hugs and kisses, and it's sometimes embarrassing in the office because you're trying to, deal with a lot of people in the office, and they want you to stop and hug them because they're so thankful.
Right?
Yeah.
Is that right?
You don't have to wear a loose-fitting denture. Every patient says the same thing after they receive their fixed set of teeth. They say, "Doctor, I wish I would have done this years ago." With your new permanent set of teeth, you no longer have to think about what you can eat when you're at a restaurant, and you can say goodbye to sticky adhesive. Most people that come in for their new teeth just want to be able to eat, chew, and laugh out loud without worrying about their dentures. What they don't expect after the procedure is completed is the reaction they get from their friends and family about their new smile. They say that people react to them differently. Well, we did our research, and in just about every survey ever published on what people find attractive in another person, it's their smile. It's always in the top 3, if not number 1. So call now and schedule your complimentary consultation.
I was faced with having to wear dentures. I was told by doctor after doctor that I would have to wear them. Then my sister told me about Dr. Henninger. And to my amazement, I was in denial that I could have permanent teeth. I wouldn't have to have dentures that I had to take in and out, possibly lose, have rubbish on my gums. This to me, not only could I get rid of the insecurity I had within, I could develop more of Heather could start coming out. Not only can I smile, not only do I eat popcorn now with a crunch, not only can I, for the first time, eat down on a cucumber, I now not only want to rebuild more relationships in my life, I no longer want to just not be the withdrawn Heather. I now know there is more out there for me. And I want others to know, to pick up that phone, because they can get the help like I did.
My doctor says it's always telling me to eat fiber, but he didn't realize that I couldn't chew. If you can't chew, you can't eat, broccoli, spinach, or whatever it is, you can't chew it. If you can't chew it, it's no good. You can't eat it. But since I've had my implants, hey, I cannot believe, I'm amazed. I'm able to chew everything, eat everything, and I can't say how great it is. And I'm also a trumpet player, if that's important or not, but I can play the trumpet. I've always been able to play pretty good. However, because my teeth were loose, I couldn't hit any high notes. But now my teeth are permanent, and I can play as high as I want, and I can practice as long as I want. I have more endurance. It's just great. It's great. It's great that you can do all these things that you never were able to do just because of teeth.
I tend to want to smile more because my smile's improved drastically. and my ability to chew food is, I don't have any issues with that anymore. So I was missing a few teeth. You couldn't see a lot of the teeth that I was missing, so my smile wasn't affected as much, but you could tell that, I needed some dental work. So now I kind of feel like I'm 20 years old again, except for the gray hair.
For the first time in over 35 years, I can eat practically anything, and I don't worry about pain, which was a big issue before, because without an upper jaw ridge, no appliance can fit, and no amounts of any of the goopy stuff will make it stay in. So once we rebuilt the jaw, once we put the implants in, I actually can eat like anybody else.
All I have is 2 implants in the bottom, and my teeth are solid. And I'm a trumpet player, and I eat anything that I want. In fact, I'm able to diet now because I could eat broccoli, I could eat corn on the cob, I could eat stuff that I was never able to eat before, stuff that is healthy for you. It's great. So don't walk to your dentist, run.
Absolutely no more dentures. I got teeth. I got my first compliment the other day. I get compliments now. No more dentures.
After well over 200 or 300 dental office visits in my life, many, again, broken jaws, pretty painful experiences. To rebuild this jaw, do the 8 implants, get the entire process fixed, was completely painless. And I'll bring a new word in, pleasant. Never in my life has pleasant been associated with a dental office, but in this case, it was done, and it was done efficiently, effectively, and pleasantly.
Let me tell you about Dr. Henninger. This guy is really, really concerned. He's always smiling, he's always happy, and he explains everything step by step. And one of the things, he told me I would have a little bit of pain, but he was wrong. I have no pain. It's perfect.
When I saw my smile for the first time, I was no longer looking in the mirror at someone that was crouching down. When I first saw that smile, I could stand up, I could smile, start doing my hair again, start putting makeup on again, start talking on the phone more again, start walking out with the dog more, outside more. Everything in life changed for the positive, towards the good, just because of a smile, because of teeth, because someone was there to help me. Someone was there, and someone will be there for you also.
Hi, I'm Debbie Siebers. Another great thing about replacing your loose-fitting denture with a fixed set of teeth is that you can eat healthy foods again. Foods that are filled with fiber. You can eat salads, carrots, apples, broccoli, or whatever your heart desires. Take charge of your health and start eating healthy food again. It's important to get fiber in your diet, and with a fixed set of teeth, you can start to eat nutritious foods again. Call the number at the bottom of the screen and find out more about your doctor and if you're a candidate for dental implants. Don't put it off. Start living a better life. And the best part, you can have it done in one day.
How about dentures? So these are options for denture wearers.
So the first option for denture wearers, Randy, is a denture with 2 implants. As simple as having 2 dental implants, you can have a lower denture.
So like on the lower.
On the lower.
Okay.
Like I said, the upper denture, it works for some people.
Okay, hold that up. So you can use our existing denture if you want?
Yes, absolutely.
And what, you just make snaps in there?
Yeah, we can reline it in less than 24 hours. Okay, with 2 snaps, you're going to have a denture that's held in by snaps. Snaps in, snaps out.
No more adhesive.
No more adhesive. It's a huge improvement over a lower denture that flops around.
Okay.
I love those dentures on the lower that flop around so much, because I know if we can do this for you, you're going to love it. You're going to be so happy. You're going to be one of those patients that's hugging me in the hallway.
Okay.
They can't stop hugging me.
You know, my father, I asked my father, and I told
That's
you I
right.
don't want to tell my story on the show, but my father went to your office, has 2 implants. And so I called him a couple of days ago, and I said, I'm going to interview one of the doctors over at Henninger's office. And I said, if you had to go back, like if they paid you, and I actually said to my father, I'm going,
Right.
if they paid you $20,000 to remove those implants and just go back to your denture, would you do it? He goes, no way.
Right.
He goes, there's no amount of money.
Yeah.
And this is a guy that I had to beg, like you have to beg your grandfather, that I'm telling him, you should try it, at least get a consult.
Right.
Can't go back. And you say, this is what everybody says.
It's a life-changing event. Just 2 implants.
Because it's different, I guess, just chewing. We take for granted
Yes.
because we have teeth.
Right. With an upper denture, Randy, you can taste your food, but you're not getting the full enjoyment that you could out of your food.
Right, because there's taste buds on your tongue, obviously.
There are.
I think.
There are.
Okay.
Yeah.
Okay, good. So the next level up then is, so the upper, you can put what, 2 or 4?
We can put 4 implants on the upper, Randy, and we can remove the palate from your denture, okay? And that gives you the full sensation of being able to taste your food again. Again, you have the advantage that your denture it snaps in, it snaps out, it's not held in by suction, no adhesive.
But you don't want to use their own denture, right? I mean, don't you want to make a new denture?
Right.
Cosmetic denture?
Randy, we do very cosmetic dentures in our office. A lot of people can't even tell that they're dentures. That's how good our dentures are.
I bet I could tell.
Nah, I bet you can.
I always feel like I could spot a denture walking
Right.
down the street. How important is the smile in your opinion? Because there's a lot of denture wearers, you tell me, that don't smile because they don't like their denture.
Right.
So how important is smile?
Smile, in my opinion,
You're a
obviously,
dentist.
I'm a dentist.
I'm guessing that you think it's super important.
I do, but there's been a lot of independent research done that says that the first thing people notice about you is your teeth. You know,
Okay.
I read a lot of literature, like the psychology literature. You know, they do top 10 things that people notice. Smiles, always number 1.
Yeah.
You've probably read the Cosmo article or the fitness.
I don't read Cosmo anymore. I don't read it
Yeah,
anymore.
used to, didn't you?
But you're right. It seems
Right.
like teeth are always in the top 3 or top 5, right?
Right.
Of attractiveness.
And your first impression with somebody, I always say your first impression is your most important impression. You know, it has to do with a lot with your smile and your teeth.
Everything we do here is to help you get the smile you've always wanted. Whether it be to ignite a new romance or find that job you've always been looking for, smiles are what we do. When you walk into the office, you're going to feel the friendly atmosphere. Oftentimes, you'll be greeted by our office manager, Jennifer. Patients love her, and it seems like she knows everybody by their first name.
Every day we see transformations in the office, and after 15 years, I never get tired of it. To see somebody smile for the first time after walking out with their new smile is just so rewarding.
As you walk into our back office, the first thing that you're going to see in our office is our CT scanner, which means less downtime for you and a more predictable result. We love having this technology right here. It makes it more convenient for us to provide you with a higher level of care. How it's normally done is you would have to be sent to an imaging center, and then you would have to come back to our office after we've read the CT scan. In addition to the CT scan, we provide digital x-rays in our office, which provide 80% less radiation than you'll find in other dental offices. I work together with Dr. Craig Henninger. He founded this practice over 25 years ago, and his patients love him. Patients travel from all over the country just to see Dr. Henninger.
23 years ago, when I started this dental practice, I wanted to be on the cutting edge of dental technology and provide the best dentistry available. And I think we've achieved that today, and it's reflected in the caring that we have in our practice, in our team, and the quality of the dentistry that we provide. Our patients leave with some of the nicest smiles, some of the greatest dentistry that is available. Well, originally when we first started implants, we used a panoramic x-ray that went all the way around, and there's magnification and different values, and we were never really sure about where we were placing the implants exactly. You really had to be careful and take x-rays as you go. Now we have something that's exact. Within 1/10 of a millimeter, we know where those implants are going.
And we have our own in-house lab. We make our crowns, our cosmetic dentures, and we even make veneers. What you see them doing is staining and glazing and polishing your crowns, getting ready to put them into the oven. What I really love is our CEREC machine. This machine allows us to create crowns, beautiful ceramic crowns, in our office in one visit. You've heard things like crowns in a day and teeth in a day. That's what's happening right here.
We do cosmetic dentistry, we do root canals, we do CEREC 1-hour crowns, we do root canal post and crowns in 1.5 hours, we do teeth in 1 hour, we do single tooth implants, we do full mouth reconstructions in a week, cosmetic dentistry. We had a patient where we did full upper, full lower reconstruction, 24 crowns in a week.
So we're able to avoid taking messy impressions by taking digital impressions. After I take digital impressions of your teeth, I'm going to design your crown. The information will be sent to the mill, and your crown will be milled right here in the office. The process takes about 25 or 30 minutes. And it allows me, as the dentist, to have complete control over the shape and contour of your crown, ensuring that it's going to fit perfectly. Patients love having this done all in one visit and not having to come back for a second visit. These are our Lisa sterilizing systems. We are committed to the cleanest work environment for our patients possible.
If somebody doesn't like their smile, they should really do something about it because it makes such a world of difference in their lives.
Well, one of the neatest things about our practice and what you can expect from our team is that we're all here to help. We're to help you achieve your goals. If it's new smile, new teeth, take care of your child, a fearful child, you have a special needs child, we see those people also. It just, anything that in dentistry that you need, implants, we can provide it. So we provide a large array of services. You know, our youngest patients are younger than 5. Oldest patients are, in the hundreds, and we can help all those people.
A big part of our practice is dental implants. Whether it be trying to replace a single tooth or stabilizing loose or floppy dentures, you often see us on TV talking about no more dentures. That's what we can do with dental implants. We meet with patients and figure out their options, whether they want a fixed set of teeth, snap-in dentures, or just a couple implants to stabilize their loose denture.
I think the happiest people are actually the people that can't even wear the denture. They gag on it, and they can't even tolerate the denture in their mouth, or they take it out a lot, or they're uncomfortable with going to the restaurant because they're going to get something underneath it. So they really have narrowed their scope of what they do in their lives. They have to plan it out based on their teeth. And then once we're done, they feel like they've been liberated again and they've regained their life back. And they're so excited about that, and they're friends for life. And we have patients that have offered, I'll talk to any of your patients anytime about what you've done for me, Doc.
I have seen patients who are so afraid to come to the dentist, and after they come in and they have their sedation dentistry, we get them to the point to where they're not afraid anymore and they don't need sedation dentistry anymore. After 15 years, I've developed so many strong friendships with so many patients. I've watched their children grow up, and they enjoy coming into the office, and I enjoy seeing them.
One of the beauties of working with Dr. Henninger is that it just expanded our capabilities, because he's one of the 10 dentists, general practitioners in San Diego that can do IV sedation, and he does a lot of wisdom teeth, complicated surgeries, complicated bone grafting, and we can work together as a team, and we really complement each other by doing that. Amazing with special kids, special needs children. The children don't even want to walk in. Once they see a white coat, they won't even walk in the door. And I've seen him walk out in the car, in the parking lot, in the back of our office, and give the child an injection in the shoulder, and then actually put his arms around him and put him in the wheelchair and wheel him in and do the IV sedation. And just an emotional experience for the whole team, also for the staff, because before this child wasn't getting treatment. And we're able to provide all that treatment in one visit. And to have a partner like that is pretty amazing. I think when somebody has achieved the goals and that they wanted in their smile, as close as humanly possible, they look in that mirror and they just say, "Thank you so much, doctor." And to see that glow as they leave is very nice.
It's interesting. When we complete a case and totally transform somebody's smile, their personality changes. It can ignite romance. It can help somebody find the job that they've always been wanting to find. It completely changes their persona.
No more dentures. You can get permanent teeth that don't come in and out of your mouth. It's like having your natural teeth back. You can bite into a red delicious apple or corn on the cob, hot off the grill. You can even eat popcorn, carrots, or a juicy steak at your favorite restaurant. And the best part of getting your fixed set of teeth with dental implants, you end up with a beautiful smile, natural looking teeth. Patients tell us it's a huge boost to their self-esteem. When you look in the mirror and you like what you see, that's when your inner smile comes out. A new smile, it can spark romance. It can open doors to a new job and add to your overall charisma. Let's face it, a smile is how you communicate to the world. So don't put it off any longer. Make the call that's going to change your life.
So there's a lot of people in San Diego that aren't smiling because
A lot of happy people in San Diego that aren't smiling, and people don't realize that you're happy.
they don't like their teeth.
Exactly.
Okay,
They're self-conscious about
so
their
no
teeth.
more dentures. Get a fixed set of teeth, like what, 4 or 6 implants, 8 implants? Just depends on the situation.
It depends on the situation. We usually use 5 or 6 implants. Again, and that's not the important part, Randy. The important part is you're getting your smile back.
So do they ever come in and tell you eating stories?
Absolutely,
Like what
Randy.
they ate?
Absolutely. The story that I hear most often is, the older gentleman that hasn't had a steak, in 4 years because of his teeth. He's able to eat with a fixed set of teeth. He can have his steak. And the story that I always like to tell people: can you imagine biting off an apple with a set of dentures? It's not going to work. Those dentures are going to fall out, and it's going to be an embarrassing experience for you. You could bite off an apple, eat a carrot, all those sort of things.
So if it's as good as you say it is, and if there's at least, let's say 10 or 30,000 plus people with an upper or lower denture, they just need to know their options. There's probably not even enough dentists to service all these people here in San Diego.
There's not, Randy. There's not. It's the patient doesn't know what's available to them. So going out and pursuing the information that's available and finding out what's right for you.
So you see the outcome.
I do.
When you're on the consult, and you kind of get excited
I do.
about it?
I do, Randy. That's the best part of my
Like
job.
when a denture comes in and tells you their misery stories, I mean, you get excited going, boy, this is going to be good.
Right.
Really?
Yeah, and the assistant who's sitting next to me, who's seen this process over and over and again, she gets that smile on her face like, I know what we can do for you. And half the time, I don't even have to be there, the assistant. She sees such dramatic changes in our patient. She just gets so fired up about it. By the time I get into the room, the excitement is just out of control.
I want to thank you. Very good stuff. Really good.
Thank you.
It was a pleasure. And I'd like you to invite you back to talk more about the highly anxious patient and what you're doing with IV sedation. Right. You're watching the Wellness Hour, leader in medical news information. I'm Randy Alvarez. If you would like to see this interview again, or if you have a friend with a loose-fitting denture, you can go on our website at wellnesshour.com, and you could put in Dr. Henninger, or you could put dental implants San Diego. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.